Experts speak on child abuse. A presentation by experts. Kathy E. Thompson, Final Senior Project, website section, Psychology 496, Dr. Jeannie M. Thorndike. Brief overview of child abuse. Unfortunately, it is very difficult for the clinician to assess children who suffer from abuse, whether it is physical, mental, or sexual, until it is in a critical phase or too late. Therefore, it is essential that any professional that works with abused children is provided with the ability to make an adequate assessment regarding probable signs of abuse and proposal of subsequent treatment. This presentation will compare and contrast two mental health professionals in their ability to diagnose and propose treatment for victims of child abuse based on their profession. It is often legal professionals such as judges and law enforcement officers that assist mental health professionals in making a proper assessment of child abuse by providing evidence of the abuse. Clinicians must be careful not to make misjudgments of incidents of suspected child abuse. Clinicians must be keenly aware of the symptoms of child abuse. Two key questions about child abuse. What is the best methods to properly diagnose a child abuse victim? And two, is internet use contributing to an increase in incidents of child abuse? Our first expert is introducing our experts. Michael Hughes, bachelor and master's in social work, has a licensed clinical social worker and state certified counselor. Michael currently works for the state in the Office of Health and Human Services. Michael has 15 years of experience as a social worker. Michael's job is to make assessments of children who are suspected of being abused and make recommendations for their treatment. Michael has authored a book based on his experience as a social worker. Michael enjoys his work. However, he is often overwhelmed with a heavy caseload. Citing Noel 2015. Our second expert is Patricia Johnson, bachelor's and master's in professional counseling. She's also a licensed professional counselor and national certified counselor. As a child abuse counselor, Patricia currently works as an independent contractor for an independently owned agency. Patricia has 10 years of experience as a counselor and specializes in the areas of depression, post-traumatic stress disorder, trauma, child abuse, and addiction. Patricia counsels both individuals and families. Patricia has published research in several journals. Patricia also enjoys her work and has an easily managed caseload. Citing socialworklicensure.org. Michael Hughes, licensed clinical social worker. Michael has conducted research studies on the causes of child abuse based on case studies he has conducted during his career, and he has also designed methods for other social workers to detect other forms of child abuse that are not easy to detect as physical child abuse. Depending on the child's age, counselors might consider using developmentally appropriate tools during sessions, such as books, puppets, dolls, or expressive art techniques like drawing or using dry erase markers on a whiteboard. These tools are useful for children who are not comfortable discussing abuse verbally. Oftentimes, children lack the vocabulary to describe the abuse. Citing Doe and Fowler, 1999. When using expressive arts techniques, the child's developmental age and the role of imaginary play must be weighed. Taking into account the client's history, cognitive abilities, level of effective expression, and coping patterns can be helpful in attempting to interpret artwork. Citing Henderson, 2013. The website recommended by this expert is National Association of Social Workers. Patricia Johnson, licensed professional counselor. Patricia has been instrumental in being a presenter at conferences to provide other counselors with the most recent resources available to enhance their abilities as counselors. Patricia has published in several journals of how the internet is contributing to the incidence of child abuse. It is not uncommon for therapists and counselors to feel that nothing in their training helps them to grapple with children who may be victims of online predators and the aspect of child sexual abuse images online. And few believe that the current treatment models used in child sexual abuse cases should be applied. Clinicians express feeling powerless to help the child deal with the possibility that his or her abuse images could be viewed online by anyone at any time that might cause them to avoid inquiring or probing about the issue altogether. One even felt it might be unethical to open up this issue without being able or knowing how to help the child resolve it. This suggests that in order to maintain ethical practice, counselors should continue to avoid asking children about online images, thereby posing an ethical conundrum for the practitioner. citing Martin 2016. The website recommended by this expert is Albuquerque Counselor. To compare and contrast these two experts, Michael Hughes, he makes diagnosis. He is a professional counseling. He's able to assess needs. Patricia Johnson is able to make diagnosis. She also does professional counseling, and she also conducts research. The two having comparison professional counseling. And references. Thank you.